Okay, so the first thing we're going to do is we're going to look at palpating the back before we start the treatment. Okay, so the first thing we'd like to do is feel the whole condition of the back, which we can do just by running our hand down like this. And what we're looking for is we're looking for any areas of tension or weakness down the whole spine. Okay. Once we've done that, we can go in with more detail and we can start palpating each of the vertebrae. Now we can generally slide down, finding any areas of interest, and then we can use fingers like this for more detailed palpation of the spine. The main features that we're looking for are subluxations and contractions and compressions in the spine. Because the spine is a tensegrity structure, what should happen is each of the vertebrae should float as part of the whole system, and it's supported by the connective tissue. The connective tissue is connected to the meridians. So as we palpate down, we can test to see whether that floating within the tensegrity structure is happening by simply gently pressing in between the vertebrae, like I'm doing here. And what we're looking for and feeling is a slight movement as the vertebrae float. If there's a block, you'll feel as if the vertebrae are fixed. And we can look at that later, how we treat that. The other thing we can look for are subluxations. What that means is there's a distortion in the spine and a possible movement of the vertebrae. Now, subluxations occur in three main forms. We can have anterior subluxations, where the vertebrae is slightly forwards, posterior, where it's back, and then we also have lateral or rotations, and you'll be able to feel them, palpate them as you go down. So let's just see if we can do that now. We'll go down. What I'm noticing here is on Shakur, on this side it's slightly tighter down this part here, just this area here. So this would be more of a jitsu type of area, and this would be more kyo. Okay, we're going down. Okay, now this vertebrae here, which is L1, okay, that vertebrae there is slightly posterior. There's not really a subluxation there because there's not any issues with it, but you can just see that that vertebrae is out. Now if that occurs with pain and discomfort and other changes in the tissue, then that may be something we wish to treat. Okay, in contrast, here we have L5, and you can probably see that is more anterior to the lumbar spine. So there's a couple of potential issues there in the lumbar spine that we might want to look at later. Okay, so that's how we would assess the whole spine in the sitting position. It can also be done in the standing position. Once we've done that, we can also switch into meridian mode, and we can palpate the meridian diagnostic areas to get an overview of the spine, which, just to review, would be lung, heart, heart protector, spleen, small intestine, kidney, bladder. Okay, and then we'd have stomach, liver, triple heater, gallbladder, kidney, large intestine. Okay, and it's worth looking out for any issues within the liver and the stomach, gallbladder and triple heater, because these sometimes encroach upon the structure and the layout of the spine. So once we've done that, we've got an overview of the entire spine in the sitting position. We've got assessment of any possible subluxations and what they are. We're assessing it as a tensegrity system, and then overlaid on top of that, we have the meridian map. And that's a very good starting point. Okay, so we've got the Newenergywork diagnostic areas. We've got the assessment of the spine as a tensegrity system. And the other very important thing to know is the U points, because often you'll get spontaneous areas of tension or pain with the relevant U points which link to the meridians and the internal organs. Okay, so now let's just see if we can find them all. Here's some anatomical landmarks. We've got the scapular spine. This is important because it points to T3. T3 is the beginning of the whole U-point story, starting off with the lungs. So let's just revise that. We've got the spine, the scapula. We've got the tip of the scapula. Okay, which we follow down, we find it there. And that's usually level with T7. So that gives us an idea where we are. Okay, we have the primary and secondary curves of the spine. So we've got the thoracic here, lumbar here, and sacrum here. We've got the narrowest part of the waist, which is usually around L2. So somewhere around here we're going to have the lumbar vertebrae, and here we're going to have the thoracic. Now it's worth dividing that up to make sure that we're ballpark in the right area. So that would be halfway down, so that would be around T6. There's the tip of the scapula, that's T7, so we know we're on track there. T3 is going to be around here, again halfway between the top of the spine and the midpoint. And let's just trace that along. Okay, it's kind of in the right area there. So that gives you the overall map. The U points are on the traditional bladder meridian, which is just on this ridge of muscle either side of the spine, the erector spinal muscle. And it's 1.5 soon from the centre of the spine. Okay, so let's just see if we can find all of those landmarks and vertebrae, and then see if we can find the U points. Okay, so here we have lung U point. This is the upper Peter group, so we've got lung. We go into the centre of the spine, feel the vertebrae, go down to the gap between 4 and 5, go out again, and that gives us the heart protector U point. Back in again, down and out, and that gives us the heart U point. Okay. Now we have quite a big gap, and personally I find it easier to work upwards from the lumbar to assess and find the next group of U points. So let's see if we can find them. Okay. Narrowest part of the waist should be around L2. So let's just see if we can feel those vertebrae. Okay, and sure enough, between my thumbs here we have L2, and between my thumbs here we have L1. We can tell the difference because here's a rib. Okay, the ribs go from the thoracic spine, and this is muscle here, the lumbar muscles. Okay, so we have T12, 11, 10 and 9. Okay. Now once we've got that positioning, let's just check here by the way, see where we are. 7, 8, 9, yeah, that's fine. Okay, so now we go down again and we have this pattern. And how I remember it is we have 4 that are all to do with the digestion. So we have liver, gallbladder, yin, yang, spleen and stomach, yin, yang, as one set. Okay, so liver, gallbladder, spleen, stomach. Okay, now we're on to the lumbar vertebrae. We go down one lumbar vertebrae, we have the triple heater U point. We go down the second lumbar vertebrae, and we have the kidney U point. We have one missing, and then we have large intestine U point, which is level with the 4th lumbar vertebrae. Okay, the so-called joint point is here, level with the 5th lumbar vertebrae, and then we go down onto the sacrum, and we have the 1st and 2nd sacral foramina, small intestine, and bladder. Okay, and that completes the whole of the U-point system. And personally, that's the easiest way I find to find them, by proportioning up and using those landmarks. one of the big surprises when we start assessing the back is the back can feel completely different in different positions. And the reason for that is because a tensegrity system under the influence of gravity is always going to give you a different layout and different information. So although we often look for consistency in each of the positions, what we'll find again and again is that gravity itself will be a factor in the way the spine's actually set up. And with Shakura now, we'll just investigate that. So we can do the same thing we did in the sitting position as we did, the same thing in the sitting position, what we're doing in the side position. So what we're doing is we're palpating down, just sliding down. Okay, I'm just feeling what's happening. Okay, and the first thing that I notice is that there's definitely a difference in the way her spine feels in the side position. What we've got here is we've got an anterior subluxation in T7, which we didn't feel at all in the sitting position, and we've got much more feeling of obstruction around here around the centre of the thoracic. Okay, and similarly when we get down here, if you can see that, you notice that we've got a much more pronounced feeling of the lumbar curvature in the lower lumbar, which again we didn't feel so much, and we didn't experience so much in the sitting position. And this is highly significant, as we'll see later, in terms of treatment and how you fit that in with what the client's told you and how you relate it to the meridians. Okay, so now let's look at Shakura's back in the prone position and see how it fits in with the other two positions that we've already done. Okay, well we can do the same thing again. We can slide our hand down. Here we are. Okay, and we've already starting to build up a picture. And so now we're really in a position where we're really just confirming previous experiences. And here's the T7 again. I don't know if you can see that. Look, that's T6 and T7 goes in there. It's just a slight anterior subluxation just there. And sure enough, we've got this feeling of obstruction around the upper thoracic, upper to mid-thoracic, that we felt quite clearly in the side position. So that seems to be the main story. And then again, we've got the lower lumbar, just feels a little bit empty there, as we felt mainly in the side position. Okay? And of course, in both the side and the prone position, we can assess the meridian map, which we superimpose over the back, just like we did in the sitting position. Okay, so finally we've got the supine position. Very important position, obviously, to assess the spine in. Again, the tensegrity system is going to adjust again, and the spine will form a different alignment with this position. Okay, now just from a practical point of view, what we're going to do is we're going to slide our hands underneath and we're going to be able to assess the spine. Fantastically useful, but you have to have the right mat. Now if you look and see how we've set this up, we've got a traditional futon, but we've also got this foam undermat. Now what that allows you to do is literally to be able to press your hand in and slide underneath, and I'm going to show you how to do that now. Okay, so we're going to start off in the lower lumbar. We've already got a few ideas about potential issues here, and we're going to check them out in the supine position. Okay, now watch this, look. We're going to press downwards like this into the mat, slide in, so I'm not actually touching Shakura at the moment, and then bringing my fingertips around the spine, and I'm palpating exactly the same way we did in the other positions, but obviously she's in the supine position. Okay, so I'm here around L3 now. I've gone from L5 up, L2, L1, and I can palpate the whole vertebrae and the soft tissue around that vertebrae. Okay, now if you'd like to just roll over Shakura just to the side, we'll just show everyone what I'm doing. So this is what's happening underneath Shakura. My hands are assessing the vertebral alignment, any rotations, subluxations, and the soft tissue as I palpate. Okay, just to give you a kind of view there. And then we can work up like this. Again, you see how I'm pressing my hand into the foam. Now let's see what we can find here. I'm obviously going to check out and see what happens around T7. Okay, very interesting. It feels quite different. In the supine position, there's a lot more tension really in the lower part of the thoracic. So we've got quite a complex picture there formed by the different positions, confirming soft tissue condition in the upper thoracic, and sometimes it's a little bit too difficult to go right up to the upper thoracic. So what I tend to do is come around here, and then you can lift up the arm like this, place your hand underneath, and that allows you again to just palpate the upper thoracic. Okay, again, if we can just roll her over this way. You see my hand is underneath here, palpating the upper thoracic. Okay, and once we've done that, we've got a complete palpation assessment of the entire spine in all 4 positions. And that will be invaluable when we go on to the next stage, which is mapping the meridian resonances, choosing points, and going into treatment.